Good morning, everybody, and happy Tuesday. Before we delve into our pulse report, and hopefully I'll be able to share my screen shortly, I did want to provide a couple of updates. The first one, as you know, last Tuesday when we met, we were discussing the early ramifications of the decision to pause the use of the Johnson & Johnson vaccine. Since we last met, the Commission on Immunization Practices has met at least once to discuss those practices, and their recommendation was to gather further information before making any further determinations on the future usage of the vaccine. From my understanding, they will be meeting again on this upcoming Friday to review more information that they have hopefully gathered on the cases that have been reported. Since we met, there have not been, as has been publicly relayed, not been any other cases acknowledged that have been concerning for the clots that were detailed in those 6 cases that were referenced last week. Again, there's 6 cases out of 6.8 million doses administered. From my understanding and further calls with CDC and FDA, that the commission wanted to gather more evidence based upon the increase in the number of Johnson & Johnson doses used over the last 3 weeks. If you recall, the period of interest was 6 to 13 days following the administration of the dose, and they wanted to get more information to see if there were any other cases reported of that behavior. Again, as best as I know and as best has been shared publicly, there have not been any further cases documented. In the meantime, as we continue to wait for that guidance, the state has issued an updated set of guidelines and things to watch for through the Board of Physicians and through providers for any of their patients or clients who may have received the Johnson & Johnson vaccine. So that said, there are no further updates related to that. We do eagerly await the ACIP's next meeting on Friday to see if we will get any further recommendations about how to move forward. Now, as a result of that, we did see some reductions in doses across the county. The local health department doses stayed the same this week they were cut from 10,000 to 7,000 last week. We were updated on Friday that this week's allotment will stay at 7,020 doses. They will be Pfizer doses. The state mass vac site that is in Germantown did see a reduction of its doses from 5,800 to 4,800 for this upcoming week's allocation, and they will be Pfizer doses as well. The second thing I wanted to put out there is that the state yesterday released new guidelines for schools to follow related to recommendations for distancing practices, as well as updated guidelines related to isolation and quarantine practices for individuals who are non-vaccinated, as well as those who have been vaccinated, to be consistent with or as close as possible to the most up-to-date CDC guidelines. That information has been shared with our colleagues at MCPS and discussed in terms of implementing those new guidelines now that they have been released into the school procedures and processes. So I will share my screen here. Give me 1 second. My screen is not coming up. Sorry, apologies. One second. Okay. So hopefully you're seeing a PowerPoint presentation, yes?
Yes.
Okay, all right. So this is our update with our most recent vaccination and transmission numbers. Again, when we talk about community transmission, here we see that our case rate continues to hold steady. So it's actually at 9.8 as of yesterday. It's important to note that our case rate is actually I think it was 22nd or 23rd in the state yesterday. Our test positivity continues to be lower than the states as well, in the same area of 22nd or 23rd. We continue to monitor the hospitalization rate, both in terms of acute hospitalizations as well as intensive care hospitalizations, and those numbers have plateaued a bit. When we look at our vaccination numbers, we've now achieved 46% of our residents, which is equivalent to 485,000 residents who've received at least one dose. And 29% of our residents, or approximately 300,000 of our residents, have been fully vaccinated. And when you look at that compared to other jurisdictions, we rank third in the state in terms of the percentage of our population having received at least one dose. Of note, when we break it down by age, you can see that our 75 and up group, we now have 74% of those folks fully vaccinated, with 83% having received at least one shot. And our 65 and up group, 68% of those fully vaccinated, and 83% having had at least one shot. Now, that makes sense given that the initial prioritization was focused on age, but we do hope that as we continue to move forward, and now that everyone over 16 is eligible to be vaccinated, that we'll start to see these numbers increase. And just as a reminder, Pfizer has requested an EUA evaluation for the use of their vaccine candidate down to the age of 12. And the FDA hearing is pending on that. This just shows how many doses we've administered over time in terms of, excuse me, the county government operations. So of that 400,000+ doses that have been administered, 177,000 of those doses have been administered through county operations. And when you break that down, here's a schematic that shows you where those doses have been administered, and the government piece as well as the mass vac site continue to be the two largest places where doses are being administered throughout the county. Here just breaks down our distribution by week, by age, and as you can see, the percentage of those in our older groups are decreasing again as they get up to higher percentages of those covered. And you see the relative vaccination rates by race and ethnicity are increasing for all of our groups, and the gaps between them are shrinking as well as we continue to move forward and increase access to the vaccine across all different age groups. Now, certainly we will continue to monitor these gaps and attempt to address this with our continued equity strategy that prioritizes those high volume zip codes based upon those who've been hit the hardest. We also are going to attempt to go through and look at from a geographic standpoint where we see the lowest rates of uptake of the vaccine and try and work hard to make sure we factor that in, as well as we continue to come up with strategies to address equity in our allocation of doses. This is our map that shows the geographic distribution of where the doses are. The darker greens are those, that means higher percentages of those over 65 vaccinated. The lighter colors show, a lower percentage. But overall in the county, again, we've got 83% of our population who's over 65 having received at least one dose, and 74% of those over 75 fully vaccinated, and 68% of those 65 to 74 who are fully vaccinated. And this is our map that we've got to do some work on, obviously, as the age eligibility has increased to those under 65. And so you see we've got some significant pockets there where we do see lower vaccine rates compared to others. This mirrors where we were in the early stages of vaccine allocation and distribution. And we will again continue to utilize our equity strategy to address those zip codes that have lower uptake that unfortunately also match up with some of our priority zip codes in terms of those who've been hit the hardest by COVID. And then this just breaks it down by vaccination. the percentage who have received a first dose over with the overlaying of the percentage of those who've been fully vaccinated. Pre-registration, we continue to encourage folks to get pre-registered within our system so that we've got your information. We as a county have not moved to an on-site registration walk-up process just yet. And Dr. Stoddard can comment further, but if I recall correctly in a meeting that we had yesterday talking about this, we still have approximately 120,000 individuals who have pre-registered who were working to get appointment slots. So unlike some other jurisdictions where the supply of doses has outstripped the demand, we are still in a situation where the number of doses we have available doesn't fully match up to the number of individuals who have requested vaccine appointments. This is just a reminder of our updated priority zip codes based upon our equity framework. There's not been, this map has unfortunately been fairly static throughout most of our vaccine allocation and distribution process. And then this just breaks down the percentage, this is the county population by age and by race and ethnicity, which underscores again the work based upon some of those geographic representations earlier that we need to do with these younger age groups in terms of making sure that folks are pre-registered, they're getting good quality information related to the vaccine, and that we're seeing them get shots into their arms. I will stop there. It's the conclusion of the presentation. Happy to answer any questions. Turn the floor over to Dr. Stoddard.
Good morning. I just want to add a few things on to what Dr. Gale said. So we do have 126,000 roughly individuals in the pre-registration list. Of those, 79,007 have already received at least one invitation and will receive multiple initial opportunities. And 47,537 have yet to receive an invitation. Obviously, this, we're adding we're down to adding about 650 to 700 new pre-registrants each day. But obviously, we're scheduling many more than that for appointments each day. And so we are working our way through the list. I think as I alluded to yesterday in the council media briefing, is I think we're probably 3-4 weeks away from getting through this list at the current rates, assuming we don't see any massive influx or massive reduction in doses. And so we have had conversations with the state about how mass vaccination sites around the state have utilized walk-up opportunities. They have generally agreed with our assessment that we will let the behavior of our residents in coming in and filling up appointments dictate how quickly we move through to another phase where we do something other than pre-registration. And so we know that will increase accessibility eventually, but obviously, as Dr. Gales alluded to, we've got a lot of people who are still waiting for an opportunity that we do not want to pass by. We continue to work with MCPS. We met with them yesterday and discussed all the challenges that they face. We're in the process of scheduling a similar meeting for non-public schools. With MCPS yesterday, they talked a little bit about the graduation planning that you all will be taking up as the Board of Health later this morning. There were only a couple schools that I think had any sort of challenges with the guidelines, largely because their stadiums are smaller than they probably should be given the size of the schools themselves. And so they'll be working through some challenges there and sharing those plans with us for us to work jointly with them to develop those graduation plans. I think as Dr. Gales has previously alluded to, working on including vaccination rates in our future guidelines for how things can move forward to reopening. Obviously, that's going to be an important part of overall keeping the public engaged with us throughout this whole process, is to show them that as we get more vaccination rates, things will get better, and obviously we want to encourage people who are on the fence about it, that getting vaccinated is in the best interest of them and their community. The last thing I'll talk about is the CCC teams, the COVID community teams. They've got events scheduled, and we're going to look to develop a weekly report where we talk about the materials they distribute, the events they hold, the quote unquote doors they knock on over time. So that's something that we're working on actively developing, is to be able to show all of that work. But in summary, they've done more than they either have done or have scheduled over the next couple of weeks more than 50 events since the beginning of March to try and encourage people to get pre-registered. And candidly, when we see events of pre-registration, we do see spikes in our pre-registration incoming, which is exactly what you want to see, is that people are hearing the message when we get out there and talk to them. And we do see more people thinking about getting pre-registered in advance. So I think those are all the things on my list that I wanted to highlight. I'm not sure if there's anyone else to provide an update. Otherwise, we'll take questions.
Thank you. Dr. Bridgers, anything to add?
Good morning, Council President Hucker. Nothing to add for me this morning. I'll just add if anything comes up to the Q&A session.
Terrific. Thank you. Okay, Councilmember Reamer.
Thank you. Nice to see everyone. Couple things I wanted to take through. If I could ask for a bit more, Dr. Gales, you mentioned that the state has provided guidance on the 3 feet distance. Could you please just expand on that? Where can we see that? I'm just very interested to see how that gets implemented. I have to say my youngest son did a lot better with school when he was back in the class. It was quite a relief for the family to be able to have him do his work at school rather than constantly fighting with him to get it done. And he's a good student, but personal story here about the value of being back in person. Could you please share a bit more about just the process, and is it guidance? Does the board need to vote on it? What can you share about that, please?
Thank you, Councilmember Rimmer, for your question. I can send you all a link to the most up-to-date guidance that they provided that goes into further detail. I think it was first presented last Thursday in a seminar or webinar to schools, and then presented to health officers on yesterday. I would say this, so again, obviously we all do think that kids do perform better.
I'm having a little trouble hearing you, Dr. Gales.
Can you hear me now?
I think so.
Is it better?
That's
okay.
Fine.
All right. So I again, thank you for your question. So I don't think there's any denying that children do perform better in person. Again, I think that any of the metrics put forward continue to promote safety and making sure that they can do so in an environment where, safety precautions are put into place. I will be happy to provide you with the link to the up-to-date guidelines. It is not something that the Board of Health needs to vote on. It's something, the guidelines have been provided from the state for the school systems to be able to follow. And consistent with the previous conversations with CDC around those physical distancing guidelines, not much has changed from that beginning. They were specific to elementary schools and not applying to some of the older categories. And the 3-foot rule still applies to the classroom setting. It does not apply to all of the other places within which the children will interact in the school, and still does impact capacity. So even though 3-foot distancing is allowed in terms of classrooms, if a case were to pop up, a high-risk contact is still considered anyone who is within 6 feet of distance in comparison to the rest. So I will be happy to send you the link to those most up-to-date guidelines. It also, in addition to the physical distancing piece, does provide some clarification around who needs to quarantine, how long they would need to quarantine, particularly those who have been vaccinated, plus minus whether or not they have symptoms.
Thank you. Just a quick comment. I read the CDC guidance on the 3-foot distancing, and it did apply to middle and high school, but there are conditions about the level of transmission in the community, and you're not supposed to do it when you're at the highest level, which fortunately we're not. So
the more challenging portion of those guidelines is the cohorting.
Okay.
In middle and high schools, typically you move between classrooms to have music class or art class. It's not, the guidelines are not intended for classrooms where you're switching throughout the day. They're intended for cohorted classrooms, meaning you are in the same room with the same students for the duration of the day.
Okay.
So
Well,
the problem for MCPS is obviously that their middle schools and high schools move to different classes. You have math class, you have social studies, etc.
I just want to know what the process. Thank you.
Yeah.
I was just trying to understand. It was news, welcome news that the state has issued its guidance that flows down to MCPS and then the Board of Education, not the Board of Health. Board of Education may make some decisions there, but that is between MCPS and the state. So I'm eager to see that. Quick comment on the graduations. I think it's just worth remembering that graduation ceremonies will be taking place in June. And by the time June comes around, I think it's reasonable to expect the conditions should be a lot better in the county. So I certainly encourage you to work on the waivers and to grant them. Kids need to graduate. They need to have the ceremony. Let the senior class be together at least once this year. I'd like to know what the latest is on the libraries. I continue to believe they should be open now. We got restaurants open. Why can't we have libraries open? What's the latest there, please?
I have an updated timeline. I do know that I think we're going to be talking about something this week about a timeline, but that was the last update I had was on Friday. So I know that they're actively engaged with the library staff and obviously having to de-entangle them from the COVID testing and other activities that they have been doing in support of public health and some of the other COVID missions, Food Access Call Center, for example. So I do think there will be an announcement about that later this week. And as we alluded to previously, we will inform the council prior to making the public announcement.
Okay. What about baby pools? Is there a reason that baby pools are not allowed in the they're shut down in our pool guidance?
Councilmember, I don't know specifically about that. We can have a conversation
That'd be
about
great.
this further.
Thanks. That's
in
enough.
terms of-
Thanks. Just wanted to flag that. I've been asked by some parents, and it did make sense to me. That might be something.
Yeah, I just so you know, I saw that in their guidelines the other day, and we meet on Wednesday mornings, and so that was one of the things I had planned to bring up. Same applies to hot tubs and other water effects, not just wading pools and things like that. So we'll take
Final two. I'm sorry, I was trying to tick through everything. Final two things. First of all, are we going door to door signing people up for vaccination appointments yet? And then secondly, in a very general way, I appreciate Dr. Gales, you shared with us the Illinois metric framework. I think it's a good one. And I think we ought to adopt something like that so that we can have a lot of public clarity and transparency about what the phasing is back to normalcy. So I know you're working on that. I just want to encourage that and hope that we could put something in place sooner rather than later. But could you please maybe whichever doctor, are we doing door-to-door signups yet for appointments?
CCC teams at this point are going door to door, but they're leaving materials, not necessarily doing in-person signups. We had a discussion about this on Monday, and there are still some volunteers. There's still some volunteers who are doing the door-to-door drop-offs who have not been vaccinated, which was something we just found out about. So I'm working with Mr. Hartman to try and schedule those people who are volunteered to do those so they can actually do those engagements. But that's something that at the CCC team, I don't know all the details about what they're working on.
Thank you. I think it would be great for us to have a report, weekly, maybe, about how many appointments we've been able to sign up through that technique. So thank you.
Thank you. Council Vice President Albornoz.
Thank you for the updates and continued hard work. A couple questions. So, fingers crossed that the federal government will once again approve the Johnson & Johnson to be readmitted. Dr. Fauci, I know, was on media over the weekend stating that he thought by Friday there would be a decision. And let me just say publicly, if the Johnson & Johnson vaccine were to be made available, I would take it because I would feel confident. But we have to also expect the practical reality that there are some that may not. Now, we are in a position to not yet have folks be able to decide whether they take the Moderna, the Pfizer, or the Johnson & Johnson. Have there been any discussions or provisions for people who, for whatever reason, choose to take the vaccine, but would prefer not to take the Johnson & Johnson? Has there been any discussion on how to handle situations like that?
Well, thank you, Councilmember Albanese, for your question. We did discuss that in the early stages of the vaccine process when we knew that there would be multiple doses. As it relates specifically now, I think we're in a holding pattern until we get further guidance in terms of how if Johnson & Johnson will still be used, if it will be fully used, if there will be contraindications for certain populations within it. But yeah, so that has been discussed to some degree, but in large part, a lot of that is contingent upon what ultimately will be decided. We have also, as part of the health officer group, had some initial discussions and, with the state on that in terms of what direction they may take, pending the final recommendation, but recognizing that there is potential anxiety to come with some folks related to the doses.
I would also add, we've been dealing with this for a little bit since the beginning, in the sense that some people have always preferred one vaccine over the other. And typically when their appointments are made, they're informed of what vaccine they'll be receiving, so they can make a choice as to accept the invitation or not accept the invitation based on the vaccine. In rare cases, like last Tuesday when we had to switch from Johnson & Johnson to Pfizer, there is a process that has been utilized on site, because the consent form is actually based on the vaccine you receive. And so, when we had to swap consent forms, we had to explain to people, you're going to get the Pfizer vaccine instead of the Johnson & Johnson. And some people, some people choose to say, no, I don't want to, or the vast majority of people say, I take whichever vaccine you receive. But typically we prefer to do it before they get to the site. So obviously they'll know you're getting this vaccine. If you don't want to get that vaccine, then, it's not like we have all the vaccines at all the sites. So we're not typically just, you get there and you pick what you want to have. It's, you come to the clinic, it's going to have, that clinic's going to be Johnson & Johnson clinic. So if you don't want that vaccine, you're not coming to that clinic.
That's helpful. And is that true of this? That's true of the state mass vaccination sites as well, right? Not just ours?
Yes.
Okay, great. That's helpful. The next question is, so, now the great news is so many people are getting vaccinated now, over 83% over the age of 65. People that have remained registered through our system, should we encourage them to unregister to help make sure that we streamline and make things a little bit more efficient? Or does that not really make a difference, because once they receive the advance notification that they're eligible for it, they can just choose not to reply and then it goes back in the queue? Or would we prefer to encourage people to unregister so we can keep things moving?
We've given people a modality to unregister, but the reality is we're using the state's Immunet data to deconflict our own pre-registration list, meaning if you've been vaccinated anywhere in the state of Maryland, you go up into the state Immunet system. So if you go to a mass vaccination site, a pharmacy, a hospital, what have you, the data goes into Immunet, and we actually use that to pare down our pre-registration list every week. So that way we know if you've been offered an opportunity within the state of Maryland. If you got vaccinated somewhere else, then you want to remove yourself from pre-registered in Montgomery County, there is a mechanism to do that on the website, and it's quite straightforward. So
okay,
people can do what they want to, not necessary.
Okay, should we encourage people to do it, or it's not it doesn't make a big difference?
It's more about people feel the need to, because they want to make sure that they're not slowing people down, and we want to give them a mechanism to do that. But the reality is we're doing it on the back end regardless, because we can't count on everyone doing it anyway.
Okay. Thank you. I appreciate that. A couple people that asked, wanted to make sure. And final question is, obviously the great news is everyone can pre-register, but there is some evidence nationally that the youngest demographic eligible is not pre-registering at the same rate as adults. Not a surprise, right? We were all 16 once, felt invincible. And for a variety of reasons, this may not be the highest priority for somebody who's a teenager or in their early 20s. Are we seeing any of that same evidence of folks not pre-registering at the same rate as older age groups, or is it tracking better here? And if it is similar to what's tracking at the national level, what efforts are we taking to encourage younger populations who are now eligible to pre-register to pre-register?
Well, I can say this, that phenomena is happening across the state. Again, as the health officers, we've been talking about it since last week, kind of in our listserv, and trying to come up with some best practices around how to rally the troops in that age group. I think that just as an aside, if you all checked your emails, I forwarded you all the information for Councilmember Reamer's request related to the school guidelines, so you should have that in your inboxes. But it also speaks to, as Dr. Stoddard mentioned, we met with MCPS on yesterday to talk about or engage around, or at least begin a conversation around, some potential strategies to engage young folks, as well as discuss, as capacity of doses increases, hopefully in the future, opportunities to be able to provide vaccines to the 16 and up group. I anticipate by the time we reach that point, potentially at least one of the vaccines will be approved down to age 12 by then, hopefully, and increase the scope. I think much in the same way that we have taken the approaches to try to get different communities based upon race and ethnicity and geography pre-registered, we've got to do some homework around engaging young folk, potentially utilizing youth ambassadors and young people who speak young people.
Yes.
Yes, young people who speak young people or teenage. I as much as I'd like to, it's been a while since I've been 16. So, making sure that we find, much like, again, in the approach that we've taken so far, community champions who have good outreach in the community, who are trusted and can translate the importance of getting vaccinated in a way that resonates with that particular community.
On that point too, we're actually bringing in some of our COVID tour volunteers who are younger people, typically, to help with the vaccination effort as well, to help us with communicating to younger people, as well as working, volunteering at some of the sites, doing outdoor, sort of line management, things like that, to engage with our young people so that they can be ambassadors for getting other young people to pre-register.
Yeah, I would just suggest, I love the thinking. So there's a really strong infrastructure in place of organizations that are youth-led to fight against vaping, to fight against tobacco use, to fight against underage drinking. That same infrastructure, which is really effective and very effective on social media, could be used to promote taking the vaccine. And so I'd love to follow up with both of you. And I know a number of my colleagues are engaged in youth development work as well, and personally and professionally interested in that subject. So now that we're in a better place and you can pre-register, would love to follow up on talking about strategy and engaging our youth. So thank you both so much for your continued leadership. Mr. President, I yield back to you.
Thank you, Council Vice President. Just to follow up on that, if I didn't hear this answer, and it's on my list. Has MCPS sent out any notification to students to get vaccinated, and will the rec department send out an invitation to parents and youth on their list?
I'm not sure. I can't speak to. I'm not sure. We can follow up with them to check with them, but I don't believe they have. At least I don't believe MCPS has. I'm not sure though.
Mm-hmm. Thanks, Councilmember Navarro.
Thank you, Mr. President. Well, first, I want to thank all of you for participating in last Wednesday's Government Operation and HHS Joint Committee, where we did discuss the efforts that are underway in terms of addressing a lot of the equity issues, and very impressed by what the different initiatives are doing. The African American Health Program, the Por Nuestra Salud y Bienestar, the Latino Targeted COVID-19 Initiative, as well as the Complete Count that now is going, has shifted under the leadership of Diane Vu, as it was referenced, regarding how to begin to go really deep into the communities and apply some of those strategies that were applied during the census. And so I was very impressed and truly amazing the work that is taking place. So with that, I was pleased to hear that the relative vaccination rates are better now for our communities of color. We're seeing some progress, yet when we look at the map, we still, I noticed that we continue to grapple with those particular areas of the county that we consistently have identified as having disproportionate impacts from the very beginning. And so I'm curious from your perspective, knowing that yes, there are particular plans that are being executed in those areas as it was shared during this joint committee. But as you can, I'm sure appreciate, we still grapple with those areas of the county continuing to be a challenge. Can you share a little bit about where you see this going? What is your assessment? In terms of the particular strategies that are going to be targeted, what do you think would be a timeline where we might begin to see some accelerated progress? I continue to be concerned because it is quite a large area, and again, has been consistent from the very beginning. So what is your assessment given these initiatives and these strategies of when we can start to appreciate some significant progress there?
Thank you, Councilmember Navarro, for your question and observation. I think that we have seen some movement already in those areas. Now, to do an even deeper dive, to get to closing that gap even more, I think part of that will, at least one of the strategies that I'm most excited about, and our team is most excited about, is being able to continue to work with our community partners who have more of a footprint in those respective areas, both in terms of the work that they've done historically, but also in terms of being able to reach out to different, community groups and have a diverse set of offerings in terms of how the vaccines are distributed. So this week, and I failed to include this in my opening comments, as you know, historically throughout vaccine distribution, we have provided different groups vaccines to be able to go out in the community and however they choose, whether it's through homebound vaccination, pop-up vaccination, we've given them the flexibility to be able to use that to leverage those relationships. And this week we've got, I believe, I'm looking at Dr. Bridges on the screen to confirm the number, over 1,200 doses that we are providing to different groups that we've trained to be able to do that. We are hopeful that as the vaccine capacity increases, hopefully comes back to a higher clip than where we are right now, we'll be able to provide even more doses to those groups to be able to be flexible and nimble in terms of the different styles and strategies to do that. For example, I know that to the earlier question around being able to get folks registered and set up for the vaccine, I know one group in particular is going to some of the social support venues where we're linking families to social support needs and food and things like that to register folks, not for that day, but to sign folks up there for a clinic the next day to then be able to do it. And I know, and that's, I won't say, I know they're still working on that platform, so I won't say who that is. And I know another clinic who has already been, CCACC has been having clinics at the Pan Asian Clinic, and Care for Your Health has also been doing a multiple array, whether it's homebound as well as going out to venues and meeting people where they are in the community to make it as low barrier access as possible. I think that's one set of strategies there that I think will help get increased penetration within those priority zip codes that will be able to meet people where they are, more so than we as the larger operation being able to try to scale these larger venues up and have people come in.
So, Councilmember Navarro, just to add to that, I know the last couple of weeks I've been pushing testing along with vaccinations, and we can't get away from that. And so as part of our strategic platform and portfolio, we have increased those rapid tests to our community partners. So as part of the vaccination effort, when they go in these spaces, they have the BioNet rapid test available for them to use to not only to test those individuals because they may or may not be sure as to whether or not they are symptomatic or asymptomatic, we've made these by net rapid test kits available. Much of the conversation, especially this morning and yesterday, as far as pharmacies making these rapid tests available, these in-home test kits, but we've made them available prior to actually these pharmacies announcing that these test kits will be sold over the counter. We made them available to our partners, our community partners, so that they can also test as well as vaccinate more folks. And so that's part of our strategic initiative. And I will repeat that until we get more folks vaccinated, we need to have them tested as well so that they can know their status and either isolate or quarantine so that we can suppress any further risk of transmission in the community.
Thank you. This kind of very targeted approach, it's so powerful because, as we all know, word of mouth is one of the best ways that information gets shared. And we know that anytime there are these, successful different initiatives going on in these communities and very targeted communities, then very quickly the word spreads, and that helps amplify what we're all trying to do here. I'll share two anecdotes. The very first test that I got was a Proyecto Salud. And while I was in line, I could hear in Spanish people calling other people saying, no, you got to come. It's very easy. It's, and you could see sort of like that communication occurring, sharing the positive experience. And just yesterday, I received a call in Spanish from Proyecto Salud, someone saying, I know that you've been tested here before, want to share with you other services that we have and that we still, that we have tests available. And I said, well, thank you very much for the call. I'm Councilmember Navarro, and I'm really, really familiar with what you're doing. And thank you for calling. But my point is that there's just so much going on in the community that perhaps we don't get to see right away. But I am convinced that if we keep steadily increasing these types of initiatives and these types of efforts, it's going to snowball. And very quickly, I think we're going to see some extraordinary numbers and things shifting. So really want to appreciate and recognize the extraordinary work of all of these folks out there, because they have been steady and they continue to step up and they continue to respond anytime that we say, can you do this other thing? They're there to do so. So thank you all for that. And also, again, shout out to all those community folks out there.
Thank you. Councilmember Katz.
Thank you very much, Mr. President. And thank you once again to all who are doing all of this necessary work. You're doing a great job. Dr. Gales, you mentioned earlier on about the Pfizer doses and what we'd be receiving. But I think we need to be clear, if someone got a Moderna dose as the first dose 4 weeks ago or 3 weeks ago, and if they come to one of our sites, they will need to get Moderna, and we would have Moderna. Is that accurate?
Yes, and I apologize again. I have to slap my hand on this because I said I would clarify I think we had the same conversation 2 weeks ago. So when we're talking about the doses that we're receiving from the state, there's two tranches of doses. There's the first doses and second doses. So when we say we got 7,000 doses this week, that's referring to first doses. So to Councilmember Katz's point, I want to make sure everybody at home understands is that whatever shot you got first will be the second dose that you get. So if you got Moderna first as your first shot, you will get a Moderna dose as a second shot. And the way the doses are sent to us, the second doses are based upon the first doses that we did 3 weeks or 4 weeks ago. So if whatever you got as your first shot, we will have that second dose available for you that was specific to that. And when we again, just to clarify, when we're throwing out saying, we're getting X amount of doses each week, that's referring specifically to those first doses. But we get a comparable amount of doses, second doses, based upon what we did a month prior in terms of distributing those first doses from that time period.
And Dr. Gales, believe me, you should not ever smack yourself on the hand. You do a great job of communicating, but but I just wanted to be clear for anyone that gets concerned. Thank you. And I know that all of us have been getting this, and wanted to be just put it on it literally on our radar. But we're coming up to the time. I guess every month is a time for weddings, but especially the May, June, July time frame, and we're getting inquiries as to if a restaurant is allowed more than fill in the blank 50 people, why could someone not have a wedding if they did the same thing that restaurants are doing? Is for safety. Why couldn't they have more than 50 people or whatever the number would be at their wedding? Are we looking into that? Are we doing something about that? Where are we on that?
Well, I would say, just again, strictly from the public health side of things, as we discussed briefly before, we're looking to update, guidelines that is inclusive of all of the different community transmission factors, hospital numbers, as well as vaccine numbers. And hopefully, as you know, we've been studying and looking at other jurisdictions who've implemented those strategies. I think that hopefully we'll be able to share that with you all very soon to be able to think through some strategies to say, if we hit these targets, here's the number of folks that could be, expanded to in terms of capacity to meet those needs. And, lots of folks say, well, we're here now, well, June will be much better. Well, we don't know that. It's very fluid. And so what we're trying to be careful about, particularly in a setting where the rest of the state is seeing much higher numbers, we're seeing higher cases of variants, we want to continue to make sure that our numbers hold steady and we don't see a comparable increase of that. Because if we do reopen things, we don't want to have to potentially be in a situation where we would see higher numbers that would cause us to have to consider walking things back. So that's a long answer, or hopefully not too long, to say for the folks at home again watching is we're thinking through how to update and make those reopening criteria more relevant, given the, particularly given the percentage of those who are vaccinated, to be able to potentially expand reopening criteria in a safe way. Now, I think it was Councilmember Reamer or Councilmember Albanos did reference in past conversations, we had shared that one state who had done that so far is Illinois in terms of breaking down the phases of reopening based upon community transmission levels as well as vaccine numbers. And that's probably the best example, at least that I know of, that I've looked at and studied and tried to break down. It will be challenging for us given that the state has not taken that approach and we can only control so much within our area. But I do think it's something that hopefully we'll be able to provide something for you all to take a look at and consider that would be able to hopefully simplify the process and give folks a sense of where we would need to be to expand that level, less so in terms of a timeline, in terms of being able to predict.
Okay. Thank you. And then the last thing I did want to mention, and Councilmember Navarro was talking about the in-home test kits. I did see, I think it was on the news this morning or last night or whatever. You don't remember exactly when you see something. But one of the things that they did mention was that some of these test kits are, have expense to them, $40 and up, and that they are not covered by insurance. So if you get it from a pharmacy. So I do think people should be aware that there are tests that are available that you can purchase on your own, but there's also the test, as you were mentioning earlier, that we are still providing, and that you don't have to purchase them on your own if that's what you want. So with that, thank you all again for everything you're doing. You do remarkable work, and we all are most appreciative. And Mr. President, I'm turning it back over to you.
Hear, hear. I second all your comments. Councilmember Glass.
Good morning. Thank you, Mr. President. And I will third those comments as well. And, again, just reiterating the encouraging news that 29% of residents have been fully vaccinated and 46% have received at least one dose. So we are working through this. and the trend lines with regard to getting people healthy and safe are increasing. So good job. Thank you, everybody. Councilmember Katz was just asking about in-home testing, and along those lines, I want to follow up on a question that I've been asking over the last number of weeks, and it was about in-home vaccination. And I know that we've been talking about a pilot program, and I think now DC is starting those efforts, and I'm receiving more and more correspondence, as I know my colleagues are, because as one or multiple members of a family are getting vaccinated, and then the homebound family member remains unvaccinated, people are starting to get concerned. And so can you provide us an update as to how that pilot program is going?
Thank you, Councilmember Glass. So I guess at this point, we're months into the vaccine distribution process. So I don't think we can call it a pilot anymore. So there's a couple different components to it, and Dr. Bridgers can chime in as well on this as he's worked closely with the team. One of the clinical partners that we referenced earlier in one of the questions have been doing homebound testing. And so we did start off with 100 doses for them to do that process. They have been getting more doses each week as time has moved forward, and they are doing a combination of homebound vaccination as well as community pop-up vaccine sites within that. We are hopefully finalizing details with one of our partners who we have used to do homebound testing throughout the pandemic to be able to provide homebound vaccination. And in addition to that, one of the things that we're excited about being able to provide doses to community partners is that they also will be able to leverage their resources to do some of those types of things in terms of homebound testing to address that. I believe the most recent information that we had was that we had approximately 1,200, maybe 12 or 1,300.
Down to 632.
Okay, well, I'm saying, so we had that many folks who had pre-registered saying that they were homebound, and we had vaccinated over half of those folks. Over 630 of those people had received a vaccine, and we continued to chip away at that list. And that was as of last week. We'll have to go back and see what the most recent numbers are on that one.
Well, I'm glad to hear that.
Councilmember Glass, if I may just add to it.
Please.
So part of that initiative to reach our homebound individuals include the state support and the FEMA strike teams, if you will. Dr. Gales in his conversation with the Maryland Department of Health and FEMA, as a follow-up conversation, we had the team scheduled to come out last week, I believe, but they've only been trained to administer the Johnson & Johnson dose and couldn't administer the Moderna and Pfizer dose. As part of that. Now, the last piece I wanted to add is that as we identify those pre-registrants or individuals who've been identified or self-reported as being homebound, we've also looked across county lines. So those individuals who may work or have individuals who reside in other parts or in other counties who may have self-reported or being caregivers of homebounds, we partner with our other local health departments to identify those individuals and to ensure that they get vaccinated or get vaccinated in those home of records. So we also want to vaccinate those caregivers of individuals who self-reported as being homebound. So those are some of the strategies, and we continue to monitor those. As Dr. Gales indicated and Dr. Stoddard indicated, we windowed the list down to 45, then it went back up as we open up registration, and we continue to monitor those and look for those duplicate individuals who may be in the system or who may have live outside the county but report some way that they are homebound in Montgomery County to get vaccinated. So all of those strategies are into play now so that we can target those individuals who reside in Montgomery County who don't have access to vaccines and to get them vaccinated.
I appreciate you talking about the technical logistics, Dr. Bridgers, because I just want to follow up on that. Based on the conversations that we've had in this public space, it had been suggested that people register, and they register on the county website. And so, Dr. Bridgers, the list that we have, is that for just the people who've registered on our system, or are we also culling the list from the state vaccination site? And I'll say that I think some people have gotten confused, right? Because a pre-registration is a pre-registration, particularly when they all look somewhat similar.
And so Dr. Stoddard can correct me if I'm incorrect, but we focus on those individuals who have self-reported and self-registered on our system, our county system, as being homebound.
Okay, very good. And I think yeah, go ahead.
Yeah, just so we're clear, the state's pre-registration system, you're actually pre-registering to come to a particular location. And so they wouldn't even, I don't even think their database even ask the question of homebound, because you're part of the process is identifying who can come to the mass vac site. It's not a statewide pre-registration, it's a mass vaccination registration system, for lack of a better description.
Excellent, thank you. And then the last question I have, you're saying that the county is doing some of this coordination with our community-based clinics or outreach groups, whoever is going into the communities. I know that I had connected some of you with some folks from the state who are looking to expand to some homebound vaccination programs as well. Have we made any headway with the state? Are they helping these efforts in any way?
Well, Dr. Bridges actually referenced one of those groups. So there's multiple groups. There's a group from the feds with FEMA. There's some strike teams coming from the state. We've worked to coordinate with those as best as possible so that there's no duplication in terms of efforts. And as you mentioned, for example, the mobile strike team that had reached out to us through FEMA actually is at the time is only trained to do the Johnson & Johnson doses. So they've had to go back to the drawing board and look at how they could potentially increase the training for their staff on those others. And not only training and administration, but also, for example, with the Pfizer vaccine, there is a reconstitution process that requires a little bit more effort than just administering the dose. And so making sure that they would have the capacity to be able to do that in the field, or have those logistics figured out in order to administer.
Well, thank you for shedding some light into the logistical hurdles that it takes to put this one little program together on top of everything else that you're doing. But it is good to hear that at least half of the individuals who have signed up through pre-registered through the county have gotten homebound vaccinations, and we're going to work through that list. So I will share that with the constituents and remind them also to pre-register with the county vaccination site. So thank you all for your work and for the updates.
Thank you. Councilmember Rice.
Thank you very much. So let me just jump in. Dr. Gales, Dr. Stoddard, Dr. Bridgers, when it comes to our 16-year-olds, obviously that are minors and will need parents' permission to be able to get vaccinated, do they have to be present with them to get the vaccination, or do they just have to sign the consent form and then the 16, 17-year-old can go in on their own? Can you clarify that for us?
Thank you, Councilmember Rice, for the question. So yes, consent is required for those under 18. There has been some flexibility in the past in terms of immunization models. For example, we were working with a group to do mobile vaccines in school settings that would have allowed for kids to bring, and sorry, the 18-year-olds, as a pediatrician, everybody under 24 is a kid to me. So allow the kids to be able to bring in a signed consent form and be able to still get the vaccine. So I think there is, we'll just have to clarify with legal, but I think there is some flexibility around that in terms of being able to administer as long as the consent has been provided by the parent.
Well, thank you for that. I think that's incredibly important. And as we're looking to market to young people, we can't forget that the parents still have to sign off. I know I have one that's about to be 16. So it's one of those where, again, it still is necessary for parents to sign off. So we'll still need to market to the parents in addition to the children to make sure that we can get them there, that their consent forms are signed, and make sure that parents are on board. Because that's one of the other things that I know you deal with, Dr. Gales, all the time as a pediatrician with other kinds of vaccinations that parents don't let their children get. So, I mean, it's one of those where I think, we certainly want to market to young people, but at the same time, we still have to not forget about parents. And so partnership with the PTSAs, certainly the adults that are there, would be incredibly important to ensuring that we can get these young people vaccinated. So to that end, with county facilities, I'm just very curious because I've noticed that, at restaurants, things like that, there is this great enhanced cleaning that goes on in between clients that come in, stores, same thing. There's enhanced cleaning. Are we doing the same thing with county buildings, recreation centers, parks, especially when it comes to bathrooms, things like that? When I picked up my daughter this past weekend, I paid very close attention to what airports were doing in their airport bathrooms, and they have what seems like enhanced cleaning mechanisms. So are we doing the same thing in the county as well?
Yeah, we have been throughout our county buildings doing enhanced cleaning. We've had cleaning teams since the very beginning. I would, however, caution, and I think there's a lot of shifting perspective on this, even from the CDC, if we could comment on this, is that what we understand about COVID-19 transmission has shifted over the last year. We've learned a lot of things about how much of the transmission is likely borne by aerosol or airborne transmission versus what's transmitted through fomites, which are objects that you touch like surfaces or pins or whatever. And the growing evidence is that the contribution of fomite transmission is likely a much smaller level. And so we've actually shifted away from some of the recommendations of the hourly cleaning, for example, or some of the really intense cleanings. You do need to clean surfaces on a regular basis. I think that's probably why we've seen a reduction in flu, candidly, is because we've done a lot better with which, flu is much more transmissible through a fomite typically. And so I think that is, it's a good practice, but probably one that is less, has become clearly viewed as less important than other things like distancing and face coverings are, particularly indoors. And so I think if we are still doing cleaning at an enhanced level relative to pre-COVID. We're doing not as much cleaning as we were doing at the beginning of COVID when we had a perception or understanding of COVID as a much different illness than we do today.
So my last question deals with graduation. And so it's very interesting because we hear so many folks on multiple sides of the issue. Let me just say, as a parent of a former graduate, so my daughter graduated last year, we had pushed for something similar to what currently is before and what you have recommended for the school system. We prayed for that. We begged, and Dr. Smith will tell you, Dr. McKnight will tell you, I was bringing up all different kinds of proposals, working with PTSAs to try and figure out. So let me just say this. While every parent would love to have their child in an arena, walk across the stage, and do the same thing that they did, parents are going to be appreciative of whatever it is that you can do beyond what my daughter did, which was stand in front of a banner in front of her high school, and we took pictures from a car that was probably about 20 feet away. That's the reality of where we were last year. And so I just want people to remember that as people continue to push for things that, again, as you said, Dr. Stoddard, it's not necessarily about hard surface transmission. It is about aerosol transmission and about, folks screaming and clapping and yelling and all the things that happen at graduations that we know put more people at risk as people are pushing towards 3 feet distance instead of 6 feet distance. Look, at the end of the day, we're still trying to keep people safe, and we still have a pandemic that's upon us. We still have students who are contracting COVID. Every day we get the updates, we see it. So it's still happening. So let's not pretend as though the virus isn't there. Let's not pretend we have a crystal ball and that we know that in June everything's going to be fine and everything's going to disappear. We don't know that. So we need to stop saying that, because I feel as though that's irresponsible and, quite honestly, risky in terms of what it is that we're doing in terms of assumptions. We need to be cautious. We need to make sure that we stamp this out. And the people who suffer are the people who look like me. And so I will not let people who look like me get jeopardized by folks who just want to have something for the sake of having something. I know that it sucks. It hurts. My daughter still, now that she's home from college, is still talking about the fact that she didn't have a graduation. But the reality is that as a father, she's safe, she's healthy, and that's my number one concern. And so I hope that people have patience in understanding that we are so close. but let's not push ourselves too far beyond what I think we know is still safe for us as we're about to get around the corner of this pandemic. So, Dr. Gales, do you feel comfortable with the recommendations and the suggestions that you've given to our school system that allow them to balance some of the wants that we know that all of our parents and students have, that I wanted as a dad for my child? So I certainly understand, with also coupling that with the safety of all of the folks that will be there in attendance, the teachers, the staff, the students, and other parents as well, in terms of making sure that we can provide an event that balances both of those needs.
Thank you, Councilmember Rice. I would say yes, from a public health perspective, we do support what has been put forward and recommended. And again, to building upon your comment about predicting in the future, we do hope that we're in a different place a month from now, or in June, or in July. And the approach that we have taken has been, in terms of trying to work with people in planning, is to say, here's what you can plan, and here's what we can safely say would be approved and doable based upon where we are right now. And if the future changes and we move in a different direction and more allotments are allowed or restrictions are lifted, then that could create the opportunity for those plans to be revised to scale up even higher. But as it currently stands with what's been put forward, we do support what has been put forward before you all today from a public health perspective.
Well, I just again want to thank you. As a parent, it really is one where, again, that flexibility is appreciated. It may not be, like I said at the beginning, what everybody wants, but the reality is that the ability to be out there in some sort of capacity, even in a limited capacity, even only if my wife were to be there and I wouldn't be able to, and I'd have to wait outside, whatever the case may be, it would still be better than what it was last year. Tremendously better than a parking lot banner graduation. So again, I just caution us about what it is that we're asking for and doing, understanding that we are light years from where we were last year. So thank you very much. Back to you, Mr. President.
I have one more comment too. I think this is really important to recognize that the governor still has a requirement for physical distancing, as he should. And I think that for the capacity for most of the venues that we're talking about for graduations, the limitation will be more having that separation between people than it will be a percentage occupancy. I suspect, even though there were 50% occupancy for all of these stadiums, for example, I don't think that all those stadiums can handle 50% occupancy with physical distancing. And so I think it's got to be clear that because of the existing requirement, and again, that requirement should be there. Because of that requirement, the percentage constraints on the stadiums will be less onerous than the fact that they have to distance 6 feet, because many of them are based on a stadium seating model where the person to your left and your right, you can spread out on a row, but front to back, you may have to skip multiple rows to get that 6 feet of distance between people and do some, sort of thatch work, alternating spots and things like that. And so we really ran into this with the spectators with youth sports, where we had to go through and MCPS worked with us to map out exactly where 6 feet of distance were in stadiums. And it became pretty clear that it's more challenging in a stadium setting than people realize to have that distancing, not just when you're seated, but also the bottleneck points of restrooms and entranceways and exitways. And so I think MCPS has put together some really good plans. I've seen similarly some very good plans. I think Ivy Mount sent us their graduation plan, which we approved. Other graduation opportunities people have been really smart about it, but I think they're realizing that it's more complicated when you have to consider distancing than just a percentage occupancy.
Okay, thank you, Council Member. Thank you, Dr. Stoddard. I think all my colleagues have asked all the questions on my list, unless I missed it, except for one, and that is, I promised to raise, is there any update or any anticipated update on the issue of concessions in theaters? I understand the concern regarding unmasking and duration and difficulty of enforcement, but some state lawmakers who felt sort of singled out brought this up. Is there any update we can provide them on that?
I don't have any update at this time for that. I will say that we have discussed that as part of our larger conversation about the next steps for reopening in terms of, types of activities that would be permissible based upon, the metrics that we've been looking at, and also factoring in increasing percentages of those vaccinated.
Councilmember Reamer.
Thanks. I just want to make a general point here. If everybody takes the vaccinations, we can go back to normal. That's the whole point. And we are on pace. We are doing really well with our population getting vaccinated. We are over half of the eligible population has received a first dose. And I don't know what our daily pace is. Last time I checked, it was 6,000, 6,500 a day. Another month of 6,500 a day, that's 300. I'm gonna make a mistake and do math in my head, but that's 300,000 people getting a first dose in a month. That's probably exceeds the number of people remaining to get a first dose. So within a month at this pace, everybody who wants to get a first dose should have gotten one. And I think it'll be about, are we succeeding in reaching communities where there's just not as close of a connection, where they're not as much part of the health system and so forth. That's where we'll be in a month. So I don't know why we wouldn't have at that time a general sense of we can be open. Like, are we really going to say that this summer, even though almost everyone has been vaccinated, the only people who haven't either don't want to or just haven't been yet reached, that for that fraction of the population, everything else will continue to be closed? I don't think that's tenable. I don't think the public will embrace that. So, and I don't think that's what anybody wants. But, I do think, unless we are no longer on pace with our vaccination campaign, then I think we're heading in the right direction. And you can see from the UK, I heard that the UK had 1 death in 3 days. They're doing the first dose first, which America should have done. I think it's an historical failure that we didn't do that from the beginning. And as far as the school situation, it's troubling to me. The Maryland is lowest in the country with students in school, and Montgomery County is lowest in the state. So I'm not sure history is going to judge us well on that. I really am not. But sorry, Dr. Gales, you wanted to comment.
Sure, thank you. I want to clarify this for the folks at home watching and let folks understand and be clear. We don't advocate for keeping things closed any longer than.
You're very muffled, Dr. Gales. Just
can you hear me now? Is this better?
Better.
Okay, all right. I'll stand up.
I don't know if you have maybe you have a paper in front of your microphone or something. I don't know. It's the first time I've heard.
I think it's just the wireless connection. It's the county Wi-Fi. So, so I just want folks at home to understand is that we, from a public health perspective, we don't advocate keeping things closed any longer than we feel are necessary to keep our residents safe. And I would like to say a special thank you to, in fact, all of our residents for adhering to what we've asked you to do, and also getting out and getting vaccinated at a high clip. It is because of all of those things and because of the cautious approach in terms of reopening in comparison to the rest of the state that I do think we will be in a better place in a few weeks in comparison to the rest of the state in terms of our community transmission levels, as well as the percentage of our folks vaccinated. What we don't want to have happen is we rush to reopen things and we are in a situation where we see cases increase. We look across the state, the numbers have doubled since early March, where we would have to be having conversations again about closing down activities, particularly given that we see increased hospitalizations. And unfortunately, we haven't reached a point as the UK where we're only having a death every 3 days. We're still seeing, COVID-related fatalities across the state. So I, again, just want to emphasize that the guidance we're providing is taking a cautious approach that has played out when you look at the numbers across the state where we are compared to other places. Again, this isn't a competition by any stretch of the imagination, but it underscores trying to balance safety as well as promoting, economics, business, and getting folks back to a sense of normalcy. We do expect, if we continue to adhere to that we will be in a different place. And as I mentioned multiple times in the briefing today, we will be putting forward in the very near future new guidance that does take into consideration, for example, percentage of folks who are vaccinated and covered that would allow for us to be able to open up further, again, respecting those safety parameters in place.
Thank you. I'll just close now and just say, our kids should be our first priority. And as adults are vaccinated, especially now, I think it's really time to let our students and our children have more of a return to normalcy. And, the vaccinations are now available. All adults are eligible. I think it's time to let kids back into libraries, go to 3 feet. Like, let's, our kids need us. We should be there for them. Thanks.
Councilman Bryce.
Okay.
So let me just say something. I've been vaccinated. My mother's been vaccinated. My father's been vaccinated. My wife still has not been vaccinated. My oldest daughter has not been vaccinated, and my youngest hasn't been vaccinated. Let's stop pretending as though just because we think that there's a certain number of vaccines out there that everybody can get vaccinated. There's still on the list waiting, as many people are who want the vaccine, who are still waiting for appointments. And so, again, I think it's disrespectful to folks to try and push folks into situations without having the availability that we know still has not been there. Now, we hope that that will come, and I appreciate everybody who continues to work hard to make that happen. But again, let's not paint these false narratives of, oh, everybody's got a vaccine who wants it, and everybody's good, and everybody's moving forward. That is not what's happening. Folks are still waiting, and who want the vaccine, who are trying to get the vaccine, who are using multiple sources, who don't have the time. My wife works in a service industry. She does not have the time to be sitting on a computer clicking when Walgreens first comes out with appointments. And so, again, keep in mind that there are people out there, especially in our service industry, who are working each and every day, putting themselves at risk to just make sure that they're putting food on the table. And they're also hoping to be able to get vaccinated. And so, again, let's make sure that we're being sensitive and respectful to those folks who continue to want to be there, who continue to want to be safe. And let's not also remember that just getting vaccinated does not mean that all of a sudden you're free from risk. There are plenty of people who've gotten vaccinated, some who have been told the story right here in this council. Councilmember Katz told the story about a person who got vaccinated who still got COVID, and it can be transmitted to other people. So again, from my perspective, even though I've been vaccinated, I could still pass it on to my wife, pass it on to my 2 daughters, and they could get it and have serious complications. So again, there's still a lot of risk out there. Let's make sure that we're also reminding people about that as well. Let's not forget that. Because again, I don't want us painting this fairy tale picture that doesn't exist right now. Yes, I wish and I hope for it. I pray for it to be soon, but it's not upon us right now. And so let's again be real about what it is that we're telling our folks, our community, so that they can continue to be safe and keep their family safe. That's what's most important. Thank you.
I know my colleague is aware. I did not say that anyone who wants one can get one now. I didn't say that. Thanks.
Councilmember Jawanda.
Thank you. Just want to, as always, don't have a ton of questions. A lot have been asked. Thank you to our public health team for all you're doing. Dr. Stoddard, the number again of people who are on the pre-registration list who have been sent an appointment versus who haven't. I know you said it earlier. I just
Yeah,
want to write it.
apologize. Let's bring it back up. There's about 126,000 people, 126,000 people, and approximately 79,007 people have been sent invitations, and the remainder, which is about 47,537, have not.
Okay, so there's almost 48,000 people who have pre-registered, won a shot, haven't been sent an invitation yet.
Correct.
Of the 126,000 on the list, and obviously we still want people to get pre-registered, and you guys are making great progress despite the fact that we've had less supply than we had in some weeks, but hopefully that'll keep going up. And I appreciate the comments from Councilmember Rice. I think I just really don't like the way. I think one of the big things of this era will be politics involved in health decisions. I mean, there's going to be books written about it, and it's not a great system. And I think we need systemic reform in how we do public health because of what's happened here across the country and other places. But that being said, I think we've done a great job for the most part, listening to the direction of public health, and that has served us well to be the largest jurisdiction and to be in the position we are with vaccination rates, despite the deep disparities, which are mostly communities of color, that we've made significant progress, and our rates reflect that as far as our infection and case rates. And so I want to thank the team, and we are moving in the right direction, but we just need to keep doing what we're doing. And I know everyone wants to get out there and do things, but I hear every day from people who aren't, for a number of reasons, who aren't vaccinated and are trying to get access. And so we just need to keep pushing. And I appreciate all the work that you all are doing. So thank you. Thank you, Mr. President.
Thank you. Okay, I don't see any other requests to speak. All my questions have been answered. Thank you all for everything you're doing. It's terrific to both see the progress that you're making and to get the updates every week.